Hi everybody, I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I focus mostly on acne and scars and pigmentation. I do a lot with collagen stimulation as well. I'm going to walk you through this case. Someone was asking me a few times yesterday if I could show some patients who are more melanated. There's a lot of questions actually about that, about how we could do scars and how we could treat skin and what we could do for pigmentation in melanated skin. So I'm going to go through how I do that because so many of my patients are patients who are Fitzpatrick 4 and above. And it's something I really pride myself on. It's something I really worked really hard to make sure I could do safely. So I'll throw this patient's results up because I've been working on him for a little bit of time now. And his results are just killer. It's just so good. At this point, it's like really hard to actually see a lot of his scars. In fact, I did see a virtual follow-up after this round. When he came in again, we had done a little bit more Bellafill for him and a little bit more TCA Cross, and it was looking even better than ever actually. So it was really cool to see that. So it's a really rewarding process here for a lot of patients who really were told that they couldn't do much because their skin type was potentially too risky. And it's like when we do more manual treatments, when we do things more with like subcision, and we do things where we give back some volume, you can get an amazing, excellent result. Tony Santana, how's it going with you? Tony is asking, hey, Dr. Qazi, I started getting dark circles, eye bags after Accutane. Any recommendations on how to get rid of them? So it's possible that it's due to post-inflammatory hyperpigmentation due to a little bit of sun sensitivity. That's probably my first guess. Whenever we are on Accutane, we're a little bit more sensitive. So I would say the best things to start with would be mostly sunblock. You could actually, along the bony process there, you could put a little bit of that Eucerin anti-pigment cream as well. And you could do that in the morning time, so that way it doesn't go right into your eyes. But be careful though, be careful with all those things because I know that you're going to be more sun sensitive. So really be really good with sunblock, just a ton of sunblock. Thank you so much. Appreciate you guys. Appreciate everybody who's coming on saying good, nice things. This is a really awesome case. This is a really great progress for this particular patient. In fact, I think we'll probably end up having some newer results. He comes all the way from New Orleans. So at some point when he comes in again, I think he's going to come in at the end of the year, and we'll see him again, and you'll be able to see just where we go with this. It's so cool. This is somebody that really a lot of what we needed to do was with subcision, and then we had to give some volume, and that's what ended up really pushing these results over the edge. So it's awesome, and I know that there's a lot of people that were asking yesterday. Actually, really over and over, I get these questions about what do we do if we are darker skin type, and how do we treat scars, and what do we do about lasers? What do we do about pigmentation? So the truth is that there's a lot of different ways, a lot of different options. Sometimes it doesn't necessarily involve lasers, although that could definitely be a component of it. But sometimes it's more about what we're doing, where we're breaking up the scar tissue. Hi, Joey. How's it going? Good seeing you on too, by the way. This particular case, for example, I actually didn't use lasers, actually. Interestingly enough, I did not use lasers. There were some areas where it's a little bit thicker, and maybe I could polish it off just a bit more, but he really didn't want much downtime, really didn't want that kind of recovery. He's somebody who is also in New Orleans. So if he did have some pigmentation issues, I'm capable of helping those out with the Pico laser, but he just wanted to have it so that it's the least amount of pigmentation risk as possible. We were able to get that really with this particular treatment, which was where we did subcision and we did Bellafill and we did TCA Cross in this case, and that's how we ended up solving this. Actually, it's awesome, and it's better and better. I followed up with this patient recently. He's saying it's awesome right now. Flynn is saying I have scars on my cheeks. When I pull my skin back, they diminish by a lot. What treatments? So it's nice that it really is possible that you don't have too much fat loss. That's a really good sign. It's possible that there may not be so much fat loss. It's possible that it's not really pulled down too much. And so maybe what we have to do is more with what we have to do more is with resurfacing, and that could potentially help you out. Some TCA Cross is also a good idea. So that's basically where we do a little bit of acid. We place it at the base of the scars, and it triggers a collagen response. 10A saying, hi, my best friend was your patient today. Awesome. I wonder which one it was. I had a lot of awesome patients today. Was he doing? Were they doing a result, or were they doing actually a treatment today, or just doing a consultation? If you know, I'm not sure. But thank you. Thanks for sending one of your friends over. Lucky Singh is saying, hello, Dr. Qazi. What's the worst case scenario with subcision? Have you had any patients with bad reactions? Thank you. So it's a good question. I have found that there's a little bit of time sometimes with some swelling. That's no big deal. Sometimes it could last more than 4 days that I expect. I did have a case. He had very, very severe acne scars, and his swelling did last a little bit longer, sometimes about 3 months or so, three months or so. I worked on it. I tried to help out with that swelling. So that was probably the longest form of some of that swelling. But really, if you're on top of it, you help resolve it, there's really not going to be much of a problem. I followed up with him. He's actually a professional athlete and, does really, really well with that whole world. And so it's like, you can see he's got, he looks awesome. So it's a lot of times just a temporary effect where you may have a little bit of swelling. I actually do massage out a lot of the fluid initially. There's less chance of hematomas. So really low likelihood of really much of a problem. I'm very, very meticulous as I do this. I'm very precise as I do it. And there's a way of doing this over and over very, very safely. Gabe, how's it going, Gabe? What's the most Bellafill sessions that you gave to somebody on the temple spread out? Well, maybe 6 to 8 vials or so. So 6 to 8, so he did maybe one on each side. Probably the temple area, 6 to 8. I think I would probably say it's the higher number. Most people will be about 4, sometimes 6 vials of Bellafill in that area. So 6 to 8, a little bit higher on the higher side. But I haven't really needed to do much more than that for most people. Like more than, I should say, 4 to 6. What was your biggest transformation? I actually showed him before. He's definitely one of my biggest ones. I had a woman also. There's a patient that I had from Puerto Rico who's got a killer result. I'll try to show his result at some point. Maybe today is Wednesday, right? Okay, so maybe tomorrow I'll show it. I shared his result before. I haven't seen him in a while. Sometimes I see him like once a year or so, and I've been working on him for several years now. His results is killer. It's awesome. Keep it Zen is saying, see you tomorrow on Zoom, the day I've been waiting. Appreciate you so much. Thank you so much. And, I'm happy to also work with you and on here. If you have some particular questions, things like that, I'll be able to answer some of those questions on here if you have any more things. But also, like when we go through the case tomorrow by Zoom, for those who don't know, I do a lot of virtual consultations. Most of my patients come from out of state, actually. And what I do is I circle the scars you have. I'll go through, zoom in, and showcase really how I'm going to really work on your scar tissue. That's what I did for this particular patient. I remember his case really, really well. It's really nice. He's somebody who was saying that he was outside. He's African skin tone, melanated skin. We have to be extremely careful with it. And there was definitely a possibility that I could have done a bit of laser over here. But because he worked a lot outside, he just really wanted to make sure that it was a lot of more minimal with his downtime. But he still trusted me to get him a great result, and we got there. And we do actually, I'm pretty sure we have his full journey on the internet too. I think you probably could see it. You definitely could see it when you're coming to our office. You could see some of that in the background over there. You could see like us do it step by step. It's amazing. A really, really wonderful patient too. Really, really great. So I love it. He comes all the way from New Orleans. DSD is saying, do you ever recommend excision? Some clients I've had said they feel like it made it worse. What do you think? That's a good question. There's a lot of controversy regarding excisions. It's really dependent on the type of scars and the location of the scars. What I check for is I want to make sure that it's around certain lines. These are called Langer's lines. I want to make sure that these are parallel to those lines, and really so we're making sure there's not much tension as we excise the scars. So I'm actually really, really careful with the scars that I excise. Sometimes people are shocked that they say, well, somebody else said that they will excise these particular scars on the nasolabial fold, and I turn it down because I really do worry about that tension. There's other ways of manipulating it, improving it without that risk where it gets worse. Hi, Mrs. Jones. Good seeing you on too, by the way. TCA Cross versus TCA chemical peel, what's better? I really find that TCA Cross, we could do a very high concentration, much, much higher than you could do with a peel. You could go right at the individual scar, be very, very precise at that. It's really, really rewarding. One of my patients today, I've been working on him since almost a year ago now. I think he said it was 6 to 8 months or so, but it looks incredible. He's of East Asian descent, and his lateral cheeks almost completely smooth, very, very smooth. I ended up doing a little bit more subcision for him on one spot really with there, and there was still a little bit of scar tissue there. And I did actually an ultrasound too when I was doing it, just to see. Some people on here were asking, why do I do ultrasound? Well, because in this case, I had done some Bellafill. And so for him, what I did was I wanted to see where there was really true, if it was true scar tissue that was pulled down, if there was fat loss. So I used the ultrasound to help with that. And then I ended up just breaking up the scar tissue a bit more. So it's a really, actually, really, really nice. I have an excellent ultrasound device that that works really well for me, and it was actually a gift from one of my patients. Actually, it was like it's so nice, and it was like this thing was like you could see the details so well. So I could do this, and actually you could see just the layers so well, and you could see the fact that sometimes we could actually see that scar tissue and just go directly in there if we need to break it up. Is keloid scar from acne on chest treatable? Yes, you likely have to do things to help with the tension. So what we want to do is we want to reduce the inflammation. So what we do is we actually do a little bit of steroid injections over there, and that helps flatten it. And then we use silicone tape as well. So Matcha is on, actually. I was just talking about ultrasound, what I was using for acne scars. So Matcha was asking me about that a few weeks ago, about why or about how I should use that a little bit more. And so I was talking about how I was doing that. He just came on right now. He's actually one of the people that was telling me really, you should start showcasing a lot more in videos, things like that, about using ultrasound for these scars. And really, as we go along over here, you're going to start seeing some more videos of that kind of stuff too, just really seeing that really, really well. So Maj is saying the bovine collagen faded away pretty quickly, more quickly than I thought. Yeah, that is actually really interesting. It does go down quite a bit there, but it is also a really interesting product because, like I said, I've done it so much myself right here. And what it is that there's a process actually where it does really regrow. You really do see it regrow a bit there, which is awesome. So you'll see it sort of just expand a bit over time. So the Bellafill goes down, and that cow collagen bit goes down. The 20% is still there though, and then you'll start to see your own collagen expand around it, which is really rewarding though. So that's why it's a patience game. That's why a lot of people just don't really understand how to use it because they try to overshoot it. They really just push too much, and then what ends up happening is they can get a little bit like unnatural then for people. So for tethered scars, could we be able to see it with ultrasound soon? I'm going to be able to do that. Actually, I have actually just ordered another product that will be. It's actually a much more advanced probe that's going to be able to get really high resolution for even those tethered bonds. So I'm going to actually do that actually. So it's going to be something that I'll be incorporating a lot more. I do so much with ultrasound, and actually Solmacha, you guys could thank Solmacha over here. And he was somebody who was like asking me, can you start doing this more? Where I showcase, with the whole journey with ultrasound. It's like, sure, why not? Actually, I have the ultrasound device. It does take a little bit more time sometimes for us and things like that. But for some patients, especially like in this particular case that I was working on today, if there's any question, if there's like some volume, if there's anything else, and some people in the past, I've done it for them when they've had actually silicone injections over there, and I don't want to do subcision where there's silicone injections, so I do some of the ultrasound for that purpose. But I'm going to start showcasing that a lot more there. You guys can see I do a lot with it, with dissolving, actually a lot of dissolving too. So you'll be able to see just go. One of the big things I learned with residency, it turned out a lot of people don't do ultrasound guided procedures. Really, a lot of people don't do it, and it's so useful. You could be very, very precise, and I'm all about that. I'm all about just going exactly in the spot that we need to. So the better things that we could do, it'll be awesome. So it's 70. So the new one that the new probe that I just got is 70 hertz. So it's going to be really, really fine. So it's going to be perfect. Actually, we could be able to see really even those tethered layers right there. Brittany is saying, is secret RF microneedling a good choice for acne scarring? I would say it's not really a good choice at all. I would not really recommend that for the vast majority of scars. Jesse is saying Bellafill before May. I like that. I'm not sure what that was reference to, but sure, do Bellafill before May. I like Bellafill. I love it. You just keep on working on the volume loss, keep on chipping away at just little bits of it. It works really, really well. Serene Mullick is saying, hi doc, I'm 25 years old. I started taking Accutane 5 years ago and now I'm getting acne again all over my face. What would you recommend me do for the acne and the PIH? It's tough to know how much there is with your acne, how severe it is. But if it is more moderate to severe, really you should strongly consider, again, going on something like isotretinoin, or you could consider something like I do, which is also the Cure laser. So either option is totally fine. But I would say if it's if it's more mild to moderate, then you could probably do something like topical retinoids, really, really useful. So make sure you're on something like a topical retinoid, like low dose tretinoin initially, something like that along those lines. And a lot of times you want to be on something like a sulfur-based medication, like dapsone works very, very well as an antimicrobial, helps actually just really so that nothing really, the bacteria just starts getting destroyed on the surface of your skin. Travel Blog is saying, hi doctor, I'm doing Subcision and laser. It will be my third laser. I'm not sure, are you with one of my patients, or is it that you did the Subcision one time and now you're doing a few times of laser? How many vials of Bellafill for this patient? I'll have to double check actually. I could give you the exact number here, Gabe. Let's see, how many vials of Bellafill? So we did a lot of Bellafill on this patient. Okay, so we started off with his journey. We did 4 vials of Bellafill initially, and that was in the cheek area and the temple area. And then I did some more Bellafill the day that he came in for this treatment, and I ended up, we'll see the new results when he comes in at some point. So now he did 2 more vials of Bellafill at this point right here when you see this photo. So you will see at some point, you'll see what happens after we did those 2 units of 2 more vials of Bellafill. It'll be cool. You'll be able to see that actually at some point. Let's see what it looks like. I think it's gonna be awesome. This was 4 vials at this point in this photo though, right here. At least that's what I had initially there. Where was I at though? Is the Cure laser the same as CO2 laser, or is it 2 different things? Oh, it's totally different things actually. The Cure laser is actually working on the oil production and on the oil glands directly. It doesn't do really anything on the surface of your skin. All it's doing is targeting your oil gland, normalizing your oil gland. So that's how the Cure laser works. CO2 laser is really for resurfacing, remodeling, restructuring the scar itself, really going at the scar tissue itself. Very, very different. So that's a totally different process there. Doctor, I have a question. Does Potenza microneedling work for acne scars? Oh, so I'm not sure if you're the same person asking earlier, but I was saying I would not recommend it for acne scars. Travel Blog is saying it will be my first time doing Subcision. That's a good option. I mean, I do think that you really should be doing Subcision if it's truly rolling scars. Just be careful with who you're going to. Make sure there's somebody that knows what they're doing, because there's a lot of people that just don't. Paris, I guess it's Paris, is saying, did you ever personally struggle with acne? Yeah, really severe. I mean, in my mind, it was very, very severe cystic acne. So now I see patients and they do have really, really severe cystic acne as well, but absolutely it was very severe cystic acne. And for me, like it was like the worst in my school, it was like the worst I've seen. So I found it really, really terrible for myself. I had to be on Accutane 3 times. And I was doing it while I was like doing wrestling, doing martial arts. I was doing a lot of that, and it was really tough, honestly. It was really bad. Like it was just like so dry. I was just like getting cuts, and like it was just like everyone's wondering why my lips were so chapped, all that kind of stuff. I used to get like made fun of for those lips that were chapped, and it was just like constant stuff like that. So it was, it was tough, really. Acne is a really, really tough thing, really tough struggle. I was fortunate that I didn't end up having severe acne scars. But, the other thing is that I did have access to physicians, but it was really difficult for me to get to isotretinoin and Accutane. Really difficult. I was finding that people were just constantly putting me in antibiotics, constantly just throwing things at me that weren't too helpful. They were telling me that, that dairy wasn't affecting my acne. It totally probably was. I definitely see a link with that. I found that it was really inflammatory. Sometimes I was even doing like whey protein, which is also really terrible. So doing all those things, and then plus I was doing wrestling, plus I was doing martial arts, and it was like really terrible for my skin. And doing soccer, so it was like, man, a whole bunch of stuff that like was like sweaty and like greasy and like a lot of bacteria on the surface of my skin. Really could have done a better job with like some education. Instead, they just had me on like oral antibiotics for a long time. It didn't really help until I was like kind of like the one that was like forcing it to get to Accutane. And it's kind of interesting, like even at a young age, I was like trying to force myself into Accutane. I did notice though that after I was an Accutane, my first time, I think I was probably like 16 or so, and I noticed that like I just stopped growing. Now, whether it's like due to that or not, it's tough to say, but high dose vitamin A can potentially close your growth plates. So it's possible that ended up happening, you know? So it was kind of like, you know, I'm glad I didn't get severe scarring though, so I'm not saying anything about that. But like, it's like, you know, there's pluses and minuses with all this stuff. It's sort of like unfair. It's like it wasn't anything I did. You know, I was like minding my own business in life, and then one day when I was like 12 and a half, I started getting really bad acne, and then it got really bad at like 13, and then really bad at 14, and then I remember like 15, especially when I was doing like a lot more with wrestling, a lot more with sports. It was just like inflamed and terrible. It was like painful. So yeah, I remember a lot of that. It was actually terrible. Actually, I'm like, yeah, it's actually now what is it? I'm 42 years old. I don't know how many years. I'm not the best at math, so whatever it was. And it's like, man, it was a long time ago, and I still remember how painful it was with that, like those cystic lesions. What is your opinion on using the Dermapen for acne scars? Not going to help much for acne scars. Really not going to help much for that. Akira is saying, can you do punch excision ice pick scars on the nose? Not going to help enough. Really, you could go underneath there, put a little bit of Bellafill. Actually, that actually sometimes could help, or something else. TCA Cross sometimes could work. Those are things that end up working out there. Gabe is saying, is there any way you could offer a discount on Bellafill if we buy 8 vials because it's super expensive? Are you saying you do it all at one time? I'm not entirely sure. I think that's usually just based on the treatment, not by the vials. But Gabe, you could always talk to our team and see what they have going for products. There is actually options really for members. If you're a member, actually you get a significant amount of a significant discount. So there's options like that they may point you to, and maybe it ends up being that they show you that then it'll be a little bit cheaper for you to be a member if you're doing that many things. So just so you know, there's we have different tiers for membership, and you could get significant discounts with your fillers portion if you're a member. What do you do for scars on the labia post-vaginalplasty? So with that area, you got to be very, very light. You don't want to use high heat, high energy. So you can actually use an erbium laser, a fraction form of the erbium laser that it can actually end up working nicely. Just you have to make sure that there's no sexual activity there for really about 2 weeks or so as it's healing. You want to make sure it's really clean over there. So there's a few things. It depends on how deep the scar is. Usually for vaginoplasty, it shouldn't be too bad. But some people say, well, CO2 laser, but I find that that's a little bit too harsh, too drying over there. So I really would prefer more with like an erbium laser. Gabe, so talk to my team actually. Yeah, and then we could see in terms of like if you're a member, you could get discounts actually for particular vials, and they'll calculate it for you and see if that makes sense for you. Bernie Smith is saying, what do you recommend for skincare after phenol peel and as a general skincare routine? What prescription medications do you recommend? I'm not sure if you've done a phenol peel yet, but really initially for the first several months, actually, we're going to go pretty light. I don't do too much. I maybe use a little bit of our pigmentation cream for initially. And then afterwards, maybe about months 3 to 6, then we may start introducing like a low dose of retinoid. So a lot of times 0.025 of Tretinoin, mix it with a moisturizer, and then slowly, like incrementally just go up on that. Very, very slow. So I'm very, very careful with patients, especially patients who have done phenol peels, and sometimes depending on your ethnicity. So patients who are Asian descent, we have to be very careful. Don't want to overheat the skin. Things are overly exfoliating. So I find people really overly exfoliate. Naked for Saint is saying, there's a segment of hypertrophic and segment of atrophic irregular, as well as a segment that is indentation due to scar fibrosis. Sounds like actually a lot of times that's what happens with burns. Actually, I'm not sure if you had a burn, but sometimes that ends up happening where there's like this hypertrophic area. There's a little bit of hypertrophy. There's like atrophic areas, and then sometimes it's just really, really fibrotic and really stuck. That's something I deal with a lot though. Anyways though, and also just people with scars, sometimes really severe scars, it could look like that. Oh, hi, Bernie Smith. Bernie Smith is saying, hi, Dr. Qazi. Is Tazorac better or Tretinoin for acne or skin aging? What would you recommend? I know Tazorac is stronger. I actually like low dose. I like low dose Tretinoin. That's actually just my go-to. I prefer it really. I think that it's a lot better for patients who have actually acne-prone skin. I really did find a lot of times, like when I was growing up, I was explaining earlier just how I had severe cystic acne. I found a lot of times people were way too harsh with acne skin. It was like in my time in the 90s, it was like everyone was telling you to just dry up your skin, and they were telling you a few things. They'll say, well, it's the reason why you have acne is because you're not washing your face. They're saying that. They're saying that the reason why you have acne is because you're not washing your face well enough. And so you need to use like these ridiculously harsh soaps to wash your face. And then they would say, you know, you also have to just like strip this layer of like junk that's over there. And so what you have to do is you have to use like really harsh scrubs, like something like St. Ives apricot scrub, and you're going to put that all over your face and rub really ridiculously harsh. And then what you're going to do is you're going to do something where you use some sort of benzoyl peroxide potentially, and then on top of the benzoyl peroxide, you're going to usually use potentially like a topical antibiotic, and then you're likely going to use some sort of retinoid, and they may put you on Tazorac or something along those lines. And now you really did just dry up your skin so much and so poorly. And what ended up happening is that you ended up actually just damaging your skin barrier. It's so dry, and then your body now tries to produce more oil, and then what ends up happening is you get more breakouts. So instead, I actually just do the opposite. I just stopped listening to all these people that were saying all these things, saying things like this over and over. It's just like they would say that it's standard of care to just dry this up. You're supposed to be drying this up. And there used to be a thing, some people, Jacqueline saying St. Ives is a blast from the past. And you know what also is a blast from the past actually was interesting? There's a thing that I used to do is to like, it was, I forgot what the guy's brand name, the guy's name was though. I used to get it from Nordstrom or something like that. And you used to dry up each individual spot. We actually just put it on the spots there, and you used to dry it up, these individual acne marks, acne lesions, and it was like exciting because they'll dry it up in real time. And then we learned now, like recently, that you really should just use more things like that are like hydrocolloid patches or silicone tape. Those things actually work really well. But in my time, it was just all about drying up acne, obsessed with drying up acne. And it ended up just you would get rebound acne. It would just get a lot worse. Mario, yes, it was that Mario thing, the Mario Badescu thing. I don't know if he's still around. This guy. He dried out my skin so much. At one point, I used to just constantly just put this on because I was just having so many cystic lesions actually. I just kept on dripping it on my face. Mario Badescu. I'm glad I'm not the only person of my generation who knows that stuff actually. It was like ridiculous. And it was just like so dry. And then we get so many breakouts afterwards. And so instead, actually just like going backwards and like it's just the basics, I should say, just go really basic and look at it and think, okay, we got to moisturize a ton. We are still going to use a retinoid. I'm not against retinoids. I love retinoids, actually. I love it. And it's like, I love doing it, but I think people just go way too harsh with it. They're going way too strong. They jump people way too fast. And it's just like this obsession. And they say, this is a standard of care. Well, you know, you guys probably never had acne. Let me just put it that way. You know, it's like the people that are pushing that stuff, they just probably didn't have acne. Because if you have acne, you'll know that it really does just like, it really does crave, even if it's like oily, you really don't want to dry up your skin like that. You really want to get moisture on there. Like you want to get a really clean moisturizer. And like Vanity Cream works really well for that. So yeah, Nux. There's so many funny things actually about that, like Vaseline. People are saying to pour Vaseline on the skin and all that stuff because you just like, I don't know, you know, it's really terrible that like, you know, that's what we grew up with. At least people are learning, but a lot of these other doctors, a lot of people out there will just stick with this old school style and just overly dry the skin. Is epidural good? It's okay. It's fine. I'm not like a big, like a huge person when it comes to just overly drying the skin. I do find it overly dries the skin still though. So I usually use more, my own personal preference is more like of sulfur-based medications, like Dapsone works very well, or just a sulfur wash even works very well. It's really wild. Actually, I learned that I was clearing up a lot of my skin. You know what happened? One time I went to Costa Rica and I went over there and I was at these volcanoes. It was like this volcano, Arnol volcano. And there was this mud mass that they have. It was actually just right outside the volcano. It was like this mud pit. And my acne was really inflamed when I was down there originally. And I went over there and I put this stuff on there and I put it all over my face. And the next day it was like so smooth and so clean. And I was asking all the locals what was in there. They said, oh, it's a really high concentration of sulfur. And it's interesting. I was like, wow, this is really interesting. Like, of course, we knew the sulfur is like helpful for acne and all those. But like, I didn't realize it was this amazing for me. It would really give me this kind of improvement. And so I'm such a huge believer of sulfur, partially because I went there. Yeah, Arnol was really beautiful. It's a beautiful area. I went zip lining the whole way down, everything like that. And then it was like the rest of my trip. A good thing I did in the beginning. And the rest of my trip, my skin was clear, and I was like super happy with that. Hi, Ali. How's it going? Ali was saying I used to use all those St. Ives scrubs. Yes, I think that we were all kind of like punished. Somehow we got punished in the 90s with those St. Ives ones there. I'm up. Good seeing you. I'm up. Is saying, what's up, doctor? Excited to see you soon. Haven't really had time to tune into the streams, but still watch most of them when I can. Appreciate you. I'm up is asking, what is the best topical for red marks left over from spots? Is AHA something you'd recommend? Yes, just be careful again, not to overly dry the skin, but it really is a good option there. What are your thoughts on oil cleansing method? Kofi's asking, what are your thoughts on oil cleansing method? So actually, I use an oil. My skin is not particularly too I don't really get breakouts anymore. It's really, really very, very rare for me to get breakouts. So it's tough for me to suggest that for acne prone skin per se. It's a little bit like still acne prone, but very, very mild now at this point. So I can't really justify it just yet. I'll probably, have some people that I know try out the ones that I use. Actually, I have one that's actually really, really good. It's this Korean brand. I think I showed it one time on one of my stories. I can't remember something, but I think I definitely took a photo of it one time. I was meant to show it up there. It was really, really good actually. But I use that, and I use that actually. Someone's asking about what to do about acne caused by shaving. I actually use that sometimes as sort of like this pre-cleanse to help with shaving. Works incredibly well actually for that purpose too. Really, really cool. So I use it, but like for acne prone skin, I can't say for sure just yet, and I'll take a look. The other thing I'm still going to take a look and see, by the way, is beef tallow. Beef tallow. I keep on doing my Chicago accent when I say beef tallow, but like everyone's like, oh, it's beef tallow, and it's so strange for me to say tallow. But beef tallow. I'm going to try that out for myself and see if that breaks me out or anything like that. We'll see how that works out. Word is saying, what is the best treatment for ice pick acne scars? TCA Cross, as well as TCA Cross works out really well. Excisions work well. Oh, you know what? Actually, the name of that brand is I don't even know how to say it. Solwasu. If anyone wants to know, it's actually called Solwasu. And it actually is actually interesting. I don't think that it is going to break people out, actually. So if anyone's ever try that, let me know. It looks like people have said that it does not break them out. So that's pretty cool. So I get it. It works out pretty well. I use Solwasu. It actually works. I don't even, someone wants to put it in the chat, feel free to put it in the chat for people so that they know what I'm talking about. So Solwasu. So that's how you say it. I don't know. Or somebody wants to correct my spelling again, so maybe knows how to say it in Korean. But it works out really, really well. That's like the oil that I use. Actually, I use it pretty much every day at nighttime. Actually, I do it twice a day. I use it for pre-cleanse for shaving, and then I do it at nighttime. So I do like it. And a lot of people say that it doesn't break them out right here. How do I spell it? I think it's like S-U, what is this thing here? Let's see, SULWHASOO. So I don't know. So someone wants to type in the chat. You could take a look and see. Try not to get things from Amazon, please. Just try to get it from like the actual companies. Just try. It's like I know I get things from Amazon too, but like try to change this world a bit. Like if we don't have to get it from Amazon, try to get it from somewhere else. It's not $200. I don't think it's $200. I don't think it's. Is it $200? I don't think so. I don't think it's $200. Is there an age for phenol peel? Well, definitely, you're going to have more severe scars. 18 and above is really reasonable if you're somebody who's like mature 18, 20 to 21-year-old. That's perfectly fine. There's a lot of studies that showcase that you don't really get your full frontal lobe until you really go at 22 years old. So I may have to just like test that out. And I find some guys, sometimes I talk to them and it's like, the frontal lobe is not really fully developed. And, if it's not fully developed in front of me, we may not be able to do the phenol peel or do some of these treatments. Just, there's some people out there that really need some more time to get more mature. No leak at the seam is saying lots of fakes on Amazon. Yeah, there's tons of fakes on there. There's tons of fakes. I actually used to I was like shocked. Someone used to tell me, oh, use this one hair shampoo. And I was like, using it. I thought this thing is junk. And then they're like, no, you have to get it from like the original company. So I got it from the original company. It was like night and day difference. And the Amazon one was just like watered down and it was like garbage. I don't know why they do that way. So many of the meso aesthetic stuff, the Cosmon stuff up there is just fake. It's just fake. And you'll actually see so many of the reviews say that they're fake. And actually, the companies told me that they've actually reported it, things like that, and they just refuse to take it down. Amazon just doesn't. They like the fact that people are buying these fake stuff on there. Ganesh is saying, doctor, if we are doing treatments continuously, will the results improve? In above picture, if we do more treatments, can we improve and get more results? Yeah, absolutely. This is what he came in for. We came in and then we ended up doing some more Bellafill for the patient and some more TCA. He comes from all the way from New Orleans, so when I see him again, it's going to be awesome. What is your opinion of Aclef as a 4th generation retinoid? I love that you know about Aclef. Not everybody knows about that. It's an awesome, I love it actually. It's really good. It's definitely something I would prefer, but the problem is that it gets rejected constantly by insurance companies, rejected constantly. It's like ridiculous, and people will pay for their insurance. I don't know how much you're paying for insurance, right now. People are paying $300, $500, $700 for their insurance every month. And then a physician says, hey, this is the best possible cream for you, the best possible medication for you. And the insurance company will be like, oh, I disagree. And it's like, not a physician, not anybody. They never seen your face. And they're just like, just refuse. Well, it could get approved by insurance, but it's like almost never. So it's like, it's wild actually. So it is expensive. It's really, really expensive. And, I do say that at least the company has dropped off some samples. So sometimes I give some samples to people, but if it's not covered by insurance, it doesn't help us out too much then. So it's like this insurance stuff is just the biggest racket in this country here. What would you recommend for oily skin? So topical things like retinoids, easiest thing. And then of course you could do low dose Accutane, or you could do the Accure laser. All options really for oily skin. What do you think of Endolift? I see people do Endolift, but I never see them actually do lipo with it, which is kind of surprising because supposedly they're melting some of that fat there. So what happens to that fat? It could just get hard actually afterwards. I'm not sure. Nafisa saying, in South Korea, I got salmon DNA injected into my acne scars. Why isn't it popular in the US? Did it work, Nafisa? Because I have a lot of patients that said they did it. It didn't really help them. It helped maybe for a little bit of their skin. They found it was really painful too. But I haven't really heard too many great things about it though. Naked for Saint is saying, does V-beam has to be done every 4 weeks, or can it be done every 2 weeks on hypertrophic scar? And what's the best way to reduce the thickness? No, I mean, you could do it every 2 weeks as long as you're healing and recovering. And I'm not sure if you're doing the V-beam with bruising or not. I don't carry V-beam myself because there's a lot more hand holding with it. There's a lot more chance of rebound pigmentation with it. I use XLV. It's really nice because you could just get really good contact cooling. I'm going to run out of time. I already ran out of time a bit. I came on just a couple minutes late, so I stayed on for a bit. But I'll answer a couple more questions for some people that were asking here. NNC is saying, does AV Clear laser work on acne? Couture, I don't think it's, I think they filed for bankruptcy. I think that, they have a good technology. They filed for bankruptcy a few weeks ago. I'm not sure if they're going to be around, to be honest with you. I use a Cure laser. It works really well. I like it because we could just get real-time feedback every time we do it. But I'm not sure what's going to happen with Couture. I don't know if anyone's seen it. I'm not sure what happened with that. They cleared bankruptcy. Their stock used to be like $60-something, and now it's like it's gone. They're bankrupt. I think they're just they're going into bankruptcy court or something like that too. So I don't know what's going to end up happening with AV Clear if you've had packages with it or anything like that. I don't know how it's going to get supported for you, to be honest with you. Jay Maz is saying, does Asian skin need to use hydroquinone days before CO2 TCA? I myself, I don't use hydroquinone. I use other skin brighteners. I don't use hydroquinone in general because I get worried about hypopigmentation because I do more fully ablative sessions. And that's what I end up working. I worry about that. But if your doctor wants to do something for skin brightening beforehand, sure, maybe this hydroquinone is right for you because he's probably doing fractionated. Bernie's asking, what are your thoughts on slugging? I think it's okay. It's just that sometimes it could cause milia around the eyes. That's the concern. So I wouldn't really recommend it, to be honest with you, especially acne-prone skin, probably not going to help out enough. Just stick with the basics. You'll see enough improvement if you just kind of go along that journey instead of putting something that potentially can make your acne worse, cause milia as well. The reason why it can cause acne worse is sometimes it could trap some bacteria underneath there, and then you could end up actually getting some flare-ups there. Let's see here. Jay is saying 6 months post-phenol. Would you argue PRP is more strategic over PRF given the faster response time? I really don't think there's much of a difference between PRP or PRFM in general. PRP works very, very well, though, as a healing, just something to help you heal. after a procedure, it works really well for that. I just never, the reason why I don't push it, because there used to be a lot of people that used to push, and to this day right now, there's a lot of people who think that PRP is going to solve your scars. It helps with the healing process. It's really good for the healing process, but I wouldn't say that it's going to solve your scars like that. It's not going to say, it's not going to improve your scars any more than any of these other treatments there. All right, guys, appreciate everybody so much. We will be back on tomorrow. There's a lot of great questions. So I saw some of them just like I did today, because some people were asking about really for melanated skin. What do we do with this? Do you inject Bellafill? Yeah, this is Bellafill right here. This was after we did Bellafill. This is 4 vials of Bellafill for this patient several months afterwards.